Estrogen does have 400 functions in the body, 400. Unfortunately, women are taught that it's evil, and many doctors tell them, do not take hormone replacement because you will get breast cancer or it will increase your risk. That is not the science. So tonight we're going to stick with the science. It does have 400 functions. So it stimulates the production of choline acetyltransferase, an enzyme which helps prevent Alzheimer's. It increases metabolic rate. Estrogen improves insulin sensitivity, regulates body temperature, helps prevent muscle damage, helps maintain muscle. It improves sleep. There's estrogen receptors on her eyes, so it helps prevent cataracts, macular degeneration, and glaucoma. Very much helps prevent and treat heart disease. Estrogen helps maintain the elasticity of the arteries. It dilates small arteries. It increases blood flow. It inhibits platelet stickiness. It decreases the accumulation of plaque on the arteries. It lowers high blood pressure. It is a calcium channel blocker. It decreases lipoprotein A. It raises HDL. It actually prevents heart disease 40 to 50%. There are studies that show all of these. They're in your book. So why would we tell someone not to take estrogen? It also helps maintain the magnesium content in the body. It helps with fine motor skills, dexterity. I didn't put it on here. It also helps with vocal cords. I would love to treat every singer in the world that goes back on tour when they're 60 or 70. For men, testosterone maintains their vocal cords. For women, it is estrogen. It also helps with a positive effect on emotions. It does all of these things: energy, mood, concentration. It helps lower homocysteine, decreases tooth loss. Every month we get referrals from dentists into our practice. I'm sure you get referrals from dentists to the pharmacy because they see the patient needs hormones because they're getting bone reabsorption in their mouth and tooth loss. Estrogen aids in the formation of neurotransmitters. So here's one reference. I'm going to give you more. There's also more associated with the book. There are so many references now that the references are not in the book. There's a website you go to and the references are updated. It's amazing. When I wrote my first book on hormones, it was this thick. The first edition of this book, my second book, was half the size, and now that doesn't even fit the references. So is the science here? It is.